All right, can everyone see? Yeah, okay. All right, wonderful. We're gonna go ahead and get started. My name is Kyle Bright, and I'm so happy to be here. I wish I could see all of your faces, but I know you're there. It's great to have you. Few things before we get started. If you have any questions, go ahead and pop them in the Q&A section if you can. We have a lot of time at the end to review that. So please use that feature for any questions you might have. And we'll go ahead and get started. So again, my name is Kyle Bright. I am National Senior Lead for Volunteerism at the American Heart Association, with a focus on our youngest supporter engagement, our youth engagement. But I've been really pleased to connect with Steve and Eileen. And again, thank you all for joining. So the purpose of this webinar is threefold. We want to share the mission of the AHA and bring to life what we do through volunteers like yourself, and especially for volunteers who might be new. We want to share what it means to be an AHA volunteer. And then lastly, we really, and most importantly, want to encourage you to engage fully in your role as a volunteer and to bring others alongside you in your journey as a volunteer for the AHA. And then I wanted to really start our webinar with a video that is especially meaningful to me, and I'm sure a lot of you here.
I was at church with my 5-year-old son Phil when we saw a man collapse. I thought for sure someone would get up to help him, but no one did. My son had immediately ran over to help him, and I followed him. Phil yelled for someone to call 911, and I started CPR right away. As I was doing the compressions, I remember him counting for me.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 16.
It felt like an eternity that I was doing CPR until the EMS had arrived. But thankfully, we saved his life. Phil turned to me and said,
"Good job, Mom."
If it wasn't for our school participating in the Kids Heart Challenge, we would not have been prepared to save someone's life. I had never done this before and I had no formal training. Phil and I had just learned hands-only CPR the week prior. His school had kicked off the Kids Heart Challenge and he came home so excited about it, and also serious about learning and watching the CPR video and Finn's mission. That night, we sat and watched the video a few times and we talked through it. Phil asked me so many questions because he knew this was important and he wanted to learn how to do CPR. I have honestly never been more proud of my son. I feel confident that if anything were to ever happen to me, my son would be prepared to help me. I'm grateful for the principal who said yes to this program, for the teachers who led it, and for the American Heart Association and their amazing programs. I think all schools should say yes to this program. These programs provide so many benefits to the school, staff, and families. And it just may save someone's life.
Thank you all for being a part of our nation of lifesavers. Thank you. I just love that video because I love how it highlights how it's our volunteers, our participants, our supporters who are making the life-saving impact every day. That young student, he's a real student, it's a real family, it's a real story. So young. He was a volunteer in his school's Kids Heart Challenge program. And because he was a volunteer, he brought home that message to his mom and inspired her to get involved. And as a family, they learned hands-only CPR. And then they went and saved someone's life. And so that is our mission in action, and you are our mission in action, and we are so grateful that you are here. So if you are able to type in the Q&A or chat, share why you're here. What inspired you to become a volunteer for the American Heart Association? We'd love to learn that from you. Now, who are we? Well, the American Heart Association is the nation's oldest largest volunteer organization dedicated to fighting heart disease and stroke. Founded by cardiologists, 6 of them, almost 100 years ago in 1924, our organization now includes more than 40 million volunteers and supporters. And our mission is clear: to be a relentless force for a world of longer, healthier lives. We improve the lives of all Americans in a number of ways. We're the nation's leader in CPR education and training, thanks to, in part, to folks like you. We help people understand the importance of healthy living and healthy lifestyle choices. We provide science-based treatment guidelines for healthcare professionals to help them give quality care to their patients always. We educate lawmakers, policymakers, and the public as we advocate for changes to protect and improve the lives of all of our communities. We also work with diverse partners from many sectors to build on a culture of health for all. Our volunteer experts select scientific research most worthy of funding and with great results. Thanks to our generous donors, we've invested more than $4 billion in research, more than any other organization outside the federal government. Anything with a B on it is almost hard to comprehend, so I'll break that down a little bit. That includes 13 Nobel Prize winners who have done life-saving research. It includes the first artificial heart valve being invented, cholesterol-lowering drugs, heart transplantation, and CPR techniques, of course. But heart disease is still the #1 killer of all Americans and globally, and stroke is still the leading cause of disability and the #5 cause of death in the United States. Our work isn't done. Our work isn't done at all. And it's thanks to volunteers like you that we are going to continue to make a difference in the lives of all. So again, if you can type in the Q&A or in the chat, go ahead and share if you have personally been affected by heart disease, or if someone in your family has. We'd love to learn about that as well. Now, our job seems easy to define: be a relentless force for a world of longer, healthier lives. But really, there's a lot more to it. And these 9 guiding values guide everything that we do. You can read them all here. I won't go through them all. I just want to pull out a couple that resonate most with me. And those are ensuring equitable health for all and inspiring passionate commitment, both of which have brought us here today. You've taken the extraordinary step of volunteering, of committing to volunteer for the American Heart Association. Something or someone some time ago inspired you to take that step and take that action and dedicate your time to inspiring others, to saving lives, and ensuring everyone everywhere has the ability to lead a long, healthy life. Your commitment, it's the heartbeat of our mission. You make this life-saving work possible. We're so grateful. I am so grateful. Just this summer, my father, who turned 76 a couple of days ago, had his 3rd open heart surgery. And for this one, we were especially nervous. We were especially scared about the procedure and the recovery, because he was so sick going into it. And it's his 3rd surgery. But he's doing amazing. And when I spoke to him on his birthday, he was bragging about how much fun he's having in cardiac rehab. Nothing makes me happier to hear those words. I think about all the phone calls we get to share, all the moments that he gets to spend with my son as a granddad. And it's those moments that you make possible. Our volunteers make those moments possible. And I'm so proud to work here at the American Heart Association and to work with volunteers like you. But we're not done yet, as I mentioned. We're not done until my family story is shared by all other families affected by heart disease. And so that's what gets me excited to come to work every day. And I hope it gets you excited to be a volunteer for the American Heart Association. Leads us to our strategic value proposition, which is to be a catalyst to maximize health impact for all. And so I want to talk again on the next slide about how we do this equitable impact. It begins with our 2024 impact goal. And as always, that's grounded in science. Our 2024 impact goal explicitly states that we will be champions for health equity. We will help identify and remove barriers that would inhibit any opportunity for a full, healthy life for anyone. As part of our 2024 impact goal, we have set 10 bold actions to address these barriers. We call them our 10 commitments. They are basically the actions we are taking to remove barriers to health equity in all areas of our work, including research, community engagement, advocacy, and more. The sweeping approach really boils down to a couple of focus areas: social factors, Many people face major health problems because of adverse social determinants of health. So these are the conditions in which people live. They're shaped by the distribution of money, power, and resources. In short, where you live in a lot of places defines how long and how well you live, and we don't think that should be the case. They're also focused on rural health. People in rural America have increased health risks, often because they live in remote areas. They suffer higher death rates from heart disease and stroke. They have lower life expectancy and higher maternal mortality. So again, these are how we focus our work and what drives us every single day. We have key priority areas that help form the basis of this work. You can see them here. They're grounded in reducing risk in women, addressing community need, ending e-cigarette and tobacco use, controlling blood pressure, improving nutrition security, and building mental well-being. Equity, again, always at the center of all that we do. I'll just elaborate on a couple of these priorities that are especially meaningful. This statistic scares me. 1 in 10 Americans is food insecure. When I think about my former hometown of Los Angeles, it's actually 1 in 5 people who are food insecure. That's children, that's families who don't have the food they need to lead a healthy life and be active. And so food and nutrition security is linked to chronic disease like diabetes, high blood pressure, of course, heart disease. And so the American Heart Association is advocating for policies and system changes that increase access to healthy food and water for all. We're collaborating with clinics, community organizations to establish nutrition security screenings and referrals for high need individuals, providing nutrition assessments and to help prevent cardiovascular disease and promote health for all. This is made possible through volunteers. You are driving our work forward. Another health disparity that you're probably very familiar with is around bystander CPR and AED rate usage. There's a lack of availability, knowledge of, and ability to afford CPR programs in communities of color, rural communities, and low-income neighborhoods, resulting in lower rates of hand-only bystander CPR and AED use. Studies also show that women are less likely to receive bystander CPR than men. The good news is the evidence shows that people who are aware of how to perform hands-only CPR are more likely to act in an emergency. So we can increase those rates through volunteers like you spreading this knowledge and awareness throughout these communities. Again, volunteers are the heartbeat of our mission and of our work. And we work at many different levels with volunteers to do this work. And so I want to talk a little bit about how the American Heart Association is structured on the next slide. We have a national center. It's located in Dallas. The national work that happens here is around advocacy, nationwide educational programs, professional education, quality emergency cardiac care, and research initiatives. There's also a lot of corporate relations, science, legal work that happens through our national center. Then we have our 5 regions, which you might be very familiar with in your volunteer work. These 5 regions are meant to maximize our coverage of the entire country. So we involve national allies in educational and advocacy efforts at the regional level. This includes pushing for statewide legislation, working with state health departments, implementing quality improvements for healthcare providers, and leading large region-wide projects and systems to aid in improving all health. At the local level, this is where we need volunteers and our local offices to drive fundraising and community education efforts. Community health, obviously a priority for the American Heart Association, and we are investing in the health of our cities and towns and neighborhoods in many different ways. We engage companies, schools in this work to raise awareness for our efforts and for our mission. We build coalitions with organizations, companies, again, schools and individuals to reach more areas and more people to strengthen the health of all. We advocate at the local and state level for policies that enable healthy living and work alongside hospitals and medical professionals to improve the quality of care that patients receive. On the next slide, we're going to watch a quick video of everything that's made possible through these amazing volunteers and officers. Wonderful. I just love that. There's been so much accomplished in the last 100 years. In that time, the AHA has grown into the largest and oldest fundraising organization dedicated to fighting heart disease and stroke. A shared focus on cardiovascular health unites our more than 40 million volunteers and supporters across the country. And we depend on your time and talents to fuel our mission forward. So again, thank you. This picture just illustrates a few of the ways that we engage volunteers, from our youngest and youth volunteerism and programs like Kids Heart Challenge to our chairs and corporate leaders who are managing some of our biggest events across the nation. And of course, at the center of the heart of all of it is our CPR and AED awareness and training led by volunteers like yourselves. So thank you. Now, we've talked a lot about broader AHA. I want to talk more about you. If you are joining today, it's because you're a valued ECC subcommittee volunteer member. And we want to take a moment to thank you for everything you accomplished and the impact you've made possible in the last year. And as you can see represented by these thousands and thousands of hearts filling up your screen, you've accomplished a lot. So let's get started. All 4 subcommittees from each of the 5 regions met or exceeded your goals for this year. Exceeded even, amazing. All 5 ECC leadership committees met silver or gold standard criteria. So if you're joining from Eastern states, woohoo, silver standard. Midwest, woohoo, silver standard. Southwest, woohoo, another silver. And Southeast and Western states, give yourselves a big round of applause for reaching gold standard. You helped bring in 139 new volunteers to the American Heart Association, bringing the total to almost 400 regional volunteers across the US. That's in all 50 states, by the way. And of the 139 new volunteers, almost all of them signed up for our You're the Cure network to be our champions for advocacy. The Leadership Development Committee recruited and orientated 13 new volunteers to take leadership roles with ECC committees. The volunteers here, you posted 309 healthy ideas to our national volunteer website this year, spreading awareness far and wide. 11 communications were sent out, reaching, wait for it, over 825,000 contacts around the country. Our 5 regions were asked to participate in 43 volunteer opportunities this year, and wait for it, all 43 of them were attended by volunteers, thanks to you. Thank you, thank you, thank you. Together, volunteers from all 5 regions completed 6,313 advocacy actions to assist our advocacy partners. Again, that's legislating and advocating for policy changes that save lives in our communities. Together, volunteers conducted 5,087 healthy events and trained 90,000 participants in healthy lifestyles and behaviors. Wow. And imagine those 90,000 participants all have families. And I'm sure they spread that knowledge beyond what they learned in their training to all their loved ones. We had 25 requests for volunteers to assist our staff partners in conducting hands-only CPR trainings. And of these requests, through them, you were able to train 31,000 individuals in hands-only CPR. Thank you. Our staff across the AHA thanks you. And finally, big drum roll, regional volunteers, you conducted 6,500 hands-only community CPR events and trained a total of 5,757,196 participants. Absolutely incredible. Congratulations again, and thank you for your hard work making these accomplishments and achievements possible. Now, we've talked a lot about how volunteerism drives the mission of the AHA, but I'd like to turn just quickly to how it actually can help your heart as well. I'm going to introduce shortly an amazing special guest who's been a longtime volunteer with the AHA, and he's going to share some of the benefits he's experienced. But I'll speak more broadly first. For decades, researchers have seen a link between better health and volunteering. And the evidence is only coming in more and more. So researchers can't explain all the connections yet, but some are clearer than others, such as the link to mental well-being and mental health. Compared to non-volunteers, volunteers have less depression, less anxiety, higher self-esteem, higher life satisfaction, greater happiness and greater sense of meaning in life. There's a recent study also from 2020 that looked at the relationship between volunteering and health in nearly 13,000 US adults over the age of 50, and found that the people who volunteered at least 100 hours a year, that's like 2 hours a week, right, had a reduced risk of dying over a 4-year follow-up period compared with non-volunteers. And so the benefits don't just end there with our, middle-aged volunteers. They actually apply to younger folks as well. A study about 10 years ago found that high school students who were asked to volunteer had better markers for heart disease risk than high schoolers who were told to wait a semester before volunteering. So really incredible stuff. Now, part of this might be tied to stress reduction. Chronic stress is, of course, a risk factor for poor heart health, and volunteering seems to alleviate its harm. Research has also linked volunteerism to increase physical activity and reduce loneliness, which, of course, those two things can have a negative impact on health and well-being if they're not, addressed. So whatever the basis of this, the results are clear. Doing good as a volunteer is good for your health. And with that, I am pleased to introduce you to one of our longest serving volunteers, Jonathan Green. Jonathan is a paramedic and an RN. He has been volunteering for the AHA since high school, unofficially. But officially, he's been involved since 1987, teaching all of our course disciplines, serving on multiple boards, and as a community activist for healthy living. He has taught 37,000 participants, and it's still growing. He has no plans to stop. He's currently employed by Lincoln Memorial University, DeBusk College of Osteopathic Medicine, as the Director of Life Support Skills, Medical Education, and as an instructor. Jonathan has a passion to teach CPR and first aid in schools, churches, and other volunteer organizations. He's been quoted as saying, "I plan on volunteering as long as the good Lord allows." And with that, I'm going to introduce Jonathan Green.
Hello, everyone. Can you hear me okay?
I can, Jonathan. I'm going to go ahead and mute myself.
All right. Thank you. Thank you, everyone, for joining. And I first began my round as an AHA and volunteer was back when I was a freshman in high school, and I noticed it said those markers were what she said about those markers. But I began back in '82 when I saw a gentleman doing CPR on this man, and I later learned that he was a CPR instructor, and I wanted to know more about it. So I went to him and I talked to him, and he said, you're interested, you're motivated, you're young. Why don't you volunteer for the American Heart Association? So I decided to do that. So while we're on this slide, this is mainly one of the slides. That instructor is standing beside me there. And actually, that picture there shows about 200 years of total of CPR instructorship through those four gentlemen. I was in one of them, of course. But the other gentlemen, they are nurses and paramedics and doctors. One of them is a doctor that stands beside me. But however, we have a wonderful connection still yet, and we work together still. So, and the next picture, I show my wife there, who hopefully is on this thing today. She and I volunteer at lots of places. We've got special events to go to. We got to go to San Diego. We got to see them where they put 8,500 AEDs in the city that week or shortly there before, which is going to make a big impact. We've got to do the heart walk there, which was amazing through the town, and got to see lots of events. But we also, that is something you do. You can involve your family with, and that's one thing I'm here to do. Is I'm here to tell you that it's great to be a volunteer. I've been doing for 37 years, and I hope to do it 37 more, but I probably won't live that long. So the next little event there, photo shows Go Red for Women. And this was the first year we had tried it when we took this picture, and it promotes, healthy living. And they come in and do amazing things. I got to talk to some people in Kingsport and visit theirs in Knoxville. Knoxville just had a heart walk in the zoo. How fun would that have been? And we didn't get to go to it, but still yet, that was an event. They probably raised a lot of money for that. And we did our Go Red for Women here and had a lot of fun with it. We had 2 guest speakers, one that had survived a cardiac arrest, one that had survived a heart attack, which is a lady who we was trying to show that there was different signs and symptoms for her. But anyway, we had a great time with that. So making a difference, 2 things I'd point out here. 2 of my favorite community involvements are to work with is You're the Cure, and the other one is Voices for Healthy Children. You get to make a difference by sending your local senator or national senator or whoever it may be. And I've 3 times had them to either call me immediately right back once they got that, or they actually sent me a letter follow up and said, yes, we're committed to this. So I thought that was awesome. Be the Beat. One of the things that I'm really big on is hands-only CPR, which you see the last 2 photos there. I was so proud of our teams making, over 5 million touches. I hope we get to increase that a lot by next year. And we can do that with the help of volunteers. You recruiting volunteers. We can get a lot of people into volunteering. I just recently walked over across the street here at the med school, and I talked to one of my instructors, and I said, I was telling him all about this event coming up, and he goes, I'll try to be there. He goes, I'd like to join some of those committees. So he ended up joining 3 committees, and he just applied for them. So I was grateful for that. So go to the next slide. Basically, I've already told you how to volunteer, how I started my volunteerism and how I got to work, but benefits to being a committed volunteer is, you've got to be consistent with, you've got to answer those emails back quickly. You've got to be motivated. You've got to be working hard. And that's one thing I was taught to do growing up, and was working hard and teaching over 37,000 people. That's just AHA classes and people. It's a lot of work. So you're teaching not only anybody in the community. Churches is a place that I like to teach. We also do all of our multiple disciplines here at this college, such as DO, PA, dental hygiene, OT, PT, law school, veterinarian. So there's a lot in nursing. There's a lot that we teach here, and I enjoy going out in the community. And we have a lot of volunteers who will come and help teach the classes. They'll help set them up in the community. But, community, we've got to make it a better community. But one thing I do want to make sure you do as you navigate your journey is make sure that you record your volunteer work. Make sure that you write it down so you can claim it later on something. And I'll say this, if I had not volunteered my job for 13 years as a training center coordinator, 330 hours a year for that many years, then I got asked if I would be interested in come here to work full time. So that led to my full-time job that I enjoy now. And it's got really benefits from it. So you never go wrong with volunteering your time. There's several ways that you can do this. It's very simple. The new generation, the young generation, the middle generation, older, it doesn't matter who it is. We all like to be on Facebook, Instagram, Twitter, and any other kind of social media. All you got to do is go in there and like things that as it relates to American Heart, or post them. Take you 5 to 10 minutes, as Steve Day usually says, and just sit there and like. And what I do is I like all the American Heart Association in our region, Southeast region, which is a gold status this past year. We're going for it this coming year. Is to go in there and just like those things and promote them. So if it can get out information quickly. And then if you're doing CPR, this is out to the people who are teaching the training centers and anybody who's volunteering. Report hands-only CPR numbers. You're doing them. You're doing it in a BLS class or an ACLS class or whatever. Report those numbers to Steve Day and the chairs. So and then of course TV and radio can get a lot of information out. So let's go to the next slide. I don't want to keep you here too long. Opportunities for being a volunteer. There's opportunities locally. You can volunteer with about any agency, but local, state, region, and United States wide. And you can also go ahead and throw in there international. There is a lot of things that you can internationally do as well. So the local that I got involved with was serving on like the Tennessee committees, or that I would volunteer for local EMS agents or volunteer rescue squad or church or any kind of committee that I could help out the special interest groups, going in and join them and making sure that they had either CPR or whatever it may be that they needed, trying to recruit them in. You can recruit church members, you can recruit your family members. It doesn't say you can't, recruit anyone. So at the state level, I got to be on the state committee right before we went to the Southeast Region Committee, which is a great committee as well. I think the state still does a lot of advocacy groups. And then also regional, where you can go into expand into many other things. Like, for example, those 4 committees that she talked about early, which is education, advocacy, communication, and education, community, and I guess I said all of them, community and communication. So they all have special things they can do. You do have to be a CPR instructor in order to be in the education committee, but it's basically you have any of these committees, it doesn't take a lot of busy work, but you can work as much as you want. But basically promoting American Heart is what you're at doing, and promoting what I say, make a good first impression when you're trying to recruit people. That way, that's what volunteers do. They're excited, they're motivated, they give quick feedback, they have a friendly demeanor about them, they work hard, they're very flexible, and they portray that excellent customer service. And that's what I've tried to do all my career here, as being an employee here at LMU, or as a unpaid employee, a volunteer, basically. So we still have to do those same policies and procedures, just like we're working somewhere. We take great pride in that. And so if your travel opportunities allow you to do that, and please look into volunteering for the American Heart Association. There's a lot of things that you can do. You can promote your experience at what you have and do there as a volunteer, maybe wherever else you are. I volunteered as a rescue squad member for many years in the EMS, and it just rolled into the American Heart Association as well. So they're part of that. And so basically, my final thoughts is volunteerism is my way of life. I have enjoyed it, and I'm going to continue to enjoy it if the good Lord allows me to do that. I am now battling the pre-diabetes phase. It's got the starting to take maybe some medication for that. So I'm going to look at the American Heart Association stuff that people have volunteered their time, and I'm going to look at it and I'm going to put it to work and see if it works. So I appreciate whoever does that. Healthy events, there's a lot of things you can do. You can send in recipes. You can send in any things that you do that promotes the American. One of my goals is to get Josh Heifel there at the University of Tennessee to let him show a video at halftime at one of the football games there at University of Tennessee. And then we can roll that through all the other big, it doesn't take that much time, a minute and 10 seconds, whatever. They waste that much time of cheering, but, and then we could reach a lot of people that way. And then I leave, I want to promote others. I want to leave a legacy of, hopefully, that I can recruit people that's going to keep holding up this way of volunteerism, and so that people can make a difference in others' life. It may be your own child, it may be your own family member, and it may be you. So, and that's what I always look for. That's why I've got my wife, make sure she's trained CPR, ACLS, PALS, and all those other things. But anyway, that's my final thoughts. And American Heart, we need you. We need you as a volunteer, and I just want to commend you for all the work that you've done, and hopefully look to see you on one of these committees soon. So have a good day. Thank you.
Thank you so much, Jonathan. You've created a legacy already, and I know you have no plans to stop anytime soon, but I can't imagine the countless lives that have been impacted both locally around your university community, your home community, but also nationwide. And we're so grateful and appreciative of all you've done. And if your wife is on, we're thankful for her too, because she's certainly shared you with us at the American Heart Association, and she deserves a medal herself for that. So thank you again. And finally, thank you to all of you for being here. Truly, your time is valuable, and we're grateful that you choose the American Heart Association to dedicate your time to. I can't say enough great things, about all of the ECC committees, subcommittees, and all that you do. So with that, going to move us along towards our Q&A session. But again, as Jonathan mentioned, truly we are grateful for all you've done, and we implore you and hopefully encourage and inspire you to come alongside us in your journey fully this year, to engage and bring others along with you. Your network, your community, they can also join us in being a relentless force for a world of longer and healthier lives. We are going to make an even bigger impact this year. So thank you. And with that, I'm going to go ahead and turn it over to our Q&A session and stop the sharing so I can see everybody. I haven't been able to see anyone all the time, so fantastic. Steve, have we received any questions in the chat?
First of all, let me tell you, I want to thank both you and Jonathan for bringing so much positivity and so much enthusiasm to this webinar. You guys have just really ramped it up, showing the importance of how much volunteerism can make a difference in your own lives, along with how it can make a difference in everyone else's lives. So thank you about that. Right now, we don't have any questions in the chat or in the Q&A, but if you have something there, please do. We did have some notes in the chat about individuals who have been affected by cardiac arrest and cardiac situations in their families, and we understand that, and we're sorry about that, but we understand that that's part of what's brought you to this, and we appreciate that you dedicate your time to the American Heart Association. You know, I've been a paramedic for 42 years. I have worked as a training center coordinator. I was a volunteer for all different realms in Arkansas. And then for the last 14 years, I have had the privilege of working with the ECC volunteers. And it's been the best job that I ever could have, to watch people give of their expertise, their passions, and to put those into play to make all those things like Kyle talked about that we accomplished last year. We have no idea all the impact that comes from that. Now, I'm going to tell you a story. One of our ECC members from the Southeast actually goes out and trains at the schools to help meet the CPR guidelines for state laws for high school kids. And during her time there, she taught many classes, and she received a call a week after one of her classes, and it was a 16-year-old girl. And that 16-year-old girl had gone home after school, and her father collapsed. And she did 40 minutes of hands-only CPR until EMS arrived, because they were in a rural area. And she saved her father. And she wanted to call and tell this member, thank you for allowing that to happen. We don't get those calls. Not all of us as volunteers get to hear that. But I guarantee you that every time you take an action on You're the Cure, every time you make an action on Voices for Healthy Kids, every time you post how to do hands-only CPR or a healthy initiative, every time you go out and teach a class and add that information in, you are going to impact someone. And there is going to be an accomplishment that comes out of that. And that's why we volunteer. That's why people have the heart to want to give, even though they don't know they're ever making a difference. But every one of you are making a difference. Now, what I want to say today is we need you and we need more of you. And, as Jonathan spoke about, we have in every one of our regions, the 5 different regions that we saw, we have openings for people in the education subcommittee, which is really making an impact by helping mentor our new training center coordinators. They are actually teaching them the foundation for what they need to do to manage their instructors and assure that there are quality courses out there. If you're a training center coordinator or you're an instructor, you understand that there are some shoddy courses out there. There's some things that are done not the way they need to be done. And our healthcare providers need to have the best knowledge, the best education to be able to assure their patients are getting the best care. And AHA has the research and the science behind them to be able to do that, as long as you allow for that class to have that guidance as it needs to be. That's what our mentors are doing in that education subcommittee. And you could be part of that. And your instructors that could be part of that. And your training center coordinators that could be part of that. So we ask you to please, make sure if you have anyone that you can recruit into your subcommittees for education that are part of that instructor or training center coordinator status, please invite them to do that. And, you don't have to know how to get them there. You can easily just send them the ability to contact me, and I will get them everything they need. It's just steve.day@heart.org. I mean, very simple, steve.day@heart.org. And we will recruit them in and bring them into the subcommittee they want. Now, if you think about all the people that could go into, say, advocacy, our advocacy subcommittee works with our legislators. They work with your local representatives. They work with the national representatives. Some things are being done on a local status. So it's all depending on what zip code you're in. Some are being done on a statewide area, and some are being done out on an overall regional area. And you, by making a quick email that is already prepared for you, all you have to do is, click on it and send it. You can absolutely improve what's going to happen at that legislative decision, because it only takes 10 or 12 information coming into a legislator that they have to start looking at what's going on. It's been proven that if we are able to get just a few people to make that decision, to send that information, and we prepare it all for you, then we can actually change the way the decisions are made for what's going to happen on clean air laws, on safe street laws, on whether kids are going to have water in schools. It amazed me when I heard that they were taking water fountains out of schools and only putting in soda fountains. Kids deserve to have the option to drink water in schools. And if we have to have laws to do that, then I guess we need to do that. You can be a person that can make that decision. And think about your family, think about your friends, think about people in the senior citizen groups that want to know about what's going on with Medicare, Medicaid, National Institute of Health, all those things. They would love to get involved in what's going on with Social Security. All those things are things that they could actually be very easily taken care of through our You're the Cure network and being part of the advocacy subcommittee. Our communication subcommittee is absolutely open to everyone, but I see it as something that would really be great if we could bring it into our younger generation. The younger generation is very big on all social medias, and our communication subcommittee sends out information that will fit into LinkedIn, into what used to be Twitter, I guess it's X, and and into Instagram and into Facebook and so forth. And then you can also email it and whatever you want to send it to. You know, that is a way to really improve the communications of what we are doing here at the American Heart Association to save lives and to improve the health of all people and try to make that increase in the longevity of living. So if you have people that you think you know love social media, love communications, love working in those areas, those would be people to recruit into that communication subcommittee. And we really need you guys, all of our volunteers, to be able to recruit for us because we can't do it ourselves. You know, we can send out messages, but it just doesn't get as far as when we send it out to you and you send it out. You know, it's the throwing the rock into the lake and then watching the ripples go out. You know, if I throw my rock into my 500 volunteers and each one of them send it to their anywhere from 10 to some people have 100,000 different contacts, we make such a greater impact in the possibility of bringing in enthusiastic, passionate, expertise people to help in these different areas. And then the last thing I'll say is our community subcommittee. Our community subcommittee is dedicated to making sure that we are always there to help with anything that deals with healthier lifestyles within your community, or making sure that bystanders know what to do in an emergency and to save lives. You know, it is horrible to be standing there watching a family member or even a bystander collapse and not know what to do. By having the knowledge of hands only CPR, by having the knowledge of what to do with an automatic external defibrillator, you can absolutely change the whole outcome of what's going to happen in this situation. And we have community individuals, they aren't even instructors. They don't have to be. They can be any individual in this United States that wants to have the ability to assist in training people on how to do this. And they don't even have to have classes. They don't have to bring people into a room. They can do it through social media. They can put it out by using our videos. They can put it out by using our different handouts that we have. They can pass this information out to make differences because then people see it, then people know it, then people learn it, and then people do it, and they save lives. And we hear story after story after story of people who have just heard or just saw it on Facebook or just was at a class that talked about it. And then they walked into a Walmart or some grocery store and someone collapsed below them and they were able to do something to make a difference. It only takes two hands and a voice. You got to call 911 and you got to make where you start CPR and do compressions. Then if an AED shows up, then you can go ahead and defibrillate. And luckily, you'll probably get that patient back if you started quick enough. You know, if you get started within the first, minute of time, then you will save a life. If it goes 4, 6, 8 minutes, time is gone and the patient will not survive or will not do well. So by all the training that these community volunteers are doing, not only are they saving lives, but then they're also telling people how to make their lives better. They're giving them healthier ideas. They're giving them impact ideas on how to make life safer and how to make life healthier for themselves, their families, their generations, etc. So, if you think about it, the realm of the 4 subcommittees that we have are unbelievable. They are amazing in the impact and the things that they accomplish. And, it is such a remarkable time to sit back and watch all of the 500 volunteers we have accomplishing as much as they do. Like we said, they trained over 5 million people last year in hands only CPR. So far this year, they've trained over 9 million people in CPR. And we're only in the first quarter of the year. So God only knows how much we're going to accomplish. But everything they do is making an impact. If you want to see other people be able to be involved in that, if you want to bring people into that, if you really are a person that loves what you do as a volunteer, then you should be wanting to drag people by their hair back into here and get them involved because they should be part of it too. So pick your friends, pick your family, pick your kids, pick your people that go to church, pick the people from everywhere that you know of and drag them in to get involved and let them be engaged and enjoy the benefits that come from volunteerism. I saw we had a few questions come in. They were addressed. I don't have anything else question wise. I will leave it for a second here, just if Kyle or Jonathan or Eileen have anything else they want to say before we call it done. But I do appreciate everyone that's on the call. This recording will go out to people that signed up. I know we had a bunch more people sign up that were able to attend, and we had assured that they would receive the recording afterwards. But any last thoughts from anybody on the call?
Nope, this is Eileen. I think you covered it, Steve. I think you did a great job, as did Kyle and Jonathan. I think the only thing that I would say is, being a volunteer for the American Heart Association is not just like a resume filler. It's really a passionate commitment to do what you can in your community to make a difference each and every day. And that's why we appreciate our volunteers, because they really do make a difference each and every day. So thank you. And if you have any other webinar topics, let Steve know. And we always, last year we put on every webinar topic that was requested, and we're happy to try to make that happen again this year. So thank you.
Thank you all.
Thank you all. Pleasure to meet you. Hopefully our paths will cross again.
Thank you, volunteer.